right, thank you everyone for being here for today's 4 o'clock briefing on the COVID-19 crisis and our local response. I know it has already been reported, but we want to begin this briefing by talking about some sad news, not just in the state, but in our community, and that is the first confirmed COVID-19 death in our state happened to occur here in our community. And that was with the passing of Mark Wagoner, who was a local attorney. And I think a lot of us know the Wagoner family. I can say that I have been in contact with his son, Mark, also named Mark Jr. It's just sad all the way around. Sad for the families, sad for those who worked with him and knew him. And it is an indication that this situation that our country is in, our state and our community is in, has entered another phase. We don't know for certain, but it is possible that this won't be the only death in our community, and we're going to have to find a way together to work through this as a community, relying upon our best instincts and our humanity as people. Because of, and that's the point I'd like to transition to, because of events that are happening all around the country, we're not going to be able to rely on tests and testing the way we wanted to, frankly, the way we thought we would be able to even a couple days ago. That's just not going to be a reality, not just for our community, for our country. The question of testing and access to testing and the science that goes into testing is not a local issue, even a state issue. It's really a national issue. And every community is coming to the realization that testing is not going to be as much of this process as we had wanted it to be. As a result, we're going to have to rely on ourselves. We're going to have to rely on each other and the goodness that is contained within all of us. I might say that this building, and I referenced this yesterday, is a building that where people work year-round planning for the next terrible event. And sometimes those events could be a tornado or a mass shooting, or the water crisis of a couple years ago springs to mind. It does strike me, though, that those events, terrible as they were or would be in the future, ultimately would be events that we would be dealing with as a community, locally, in some ways alone. What is happening here now is not something we're battling alone. This is something that is affecting the entire country and indeed increasingly the entire world. We are united as people in dealing with this crisis. As a result, I can't think of an example better than the way we felt about ourselves and our nation in the weeks and days after September 11th as a comparison of what I hope could emerge from the time that we face now. That too was a national event that obviously didn't just affect Washington, D.C. and New York City, it affected all of us. And it was a terrible event, the most terrible of my lifetime. We don't yet know how terrible this event will be, though we're prepared for and will assume that'll be as awful as any of us can bear. But while there was an awful lot of negative that came out of what happened on September 11th, there there were the days and weeks and months after that event that reminded us that there is a common humanity and a togetherness that on our best days are what this country is all about, this community is all about. I think there is the potential for something similar to emerge in the wake of what we're going through now. Sure, there will be almost incalculable pain caused by this event to individuals, to the loss of life, to the devastation of local economy and local businesses in ways that we can't even imagine. This is going to be an extraordinarily difficult time for everyone. And we've said that all week, but I don't think it can be said enough. We will not go back to normal for a long time. And I suppose if when you ponder what might be coming and you find yourself wanting to buy toilet paper and guns, okay, you can do that. You're allowed to do that. I might encourage us, though, to use our time to also make a donation to the United Way, to do what I read today or maybe it might have been yesterday. There was the picture of the two young men on the cover of the newspaper making peanut butter and jelly sandwiches for kids who might otherwise not have a nutritious meal to eat since schools are closed. I'm reminded of a local restaurateur that we all know named PK, who owns Balance Grill. He today called to the emergency center wanting the phone number of the major hospitals and health centers in this community. Why? So he could donate his food, his restaurant's food, to the first responders and the nurses and doctors who are putting in huge hours as a result of this situation. There is goodness within us, and those are the things that I want us to rally around as we enter this difficult period. Yes, it will be tough, but we've been through tough times before, and we have gotten through it because of what we have inside of all of us. I've mentioned it before, but I have found myself this week reflecting on what Abraham Lincoln said at the end of his first inaugural address, that eventually the mystic chords of memory will swell within us, and we will again be touched by the better angels of our nature. We have angels in our nature that cause us to donate food, to donate to the United Way, to make peanut butter and jelly sandwiches for kids who otherwise wouldn't eat. Let's focus on those things. Let's be good. We can do it. There are going to be a number of inconveniences. And inconveniences is too mild a word in many ways. But there are still so many things that we can do to make a difference. Go for a walk. You can go for a walk. Go to the park and play catch with your son. Or throw a frisbee with your granddaughter, if you can, if you're healthy enough to do that. You can do those things. You can do what our family did the other night. You can play a board game. It's been a long time since we played a board game, I can tell you, and there was something wonderful about that experience. It would have been more wonderful had my daughter Emma not cheated, and I would have won, but that's part of the reconnection that we need to do. If you're my age, call your mom, call your dad. They're in their 70s. Goodness knows they want to hear from you. If you're a little younger than me, call your grandparents. I know they'd want to hear from you. Let's think of others and let's get through this together. We can do it. We can do it. Because we are good. And we will respond, as Lincoln said, to the better angels of our nature. So with that, I would like to turn it over to the president of the Lucas County Commission, Tina Skeldon-Wozniak.
You know, I'm so glad that in this difficult time, we have a really, really kind Toledo mayor. So I loved the words that he gave to help our community feel better. in some way, or to have tips on how to feel better about some of the trials and tribulations that we're facing right now. Also to thank the EOC, Wade and myself, and my also very kind colleagues, Pete Gherkin and Gary Byers, who we are all part of the Emergency Operations Center, and we're all gathered here today to continue to provide what we know and message about how to get through this as a community together. So I continue to tell you that they're working very hard all the time to keep an effort going that has a lot of continuity. So rest assured that is occurring. In behalf of Lucas County and in behalf of the Board of County Commissioners, we too send our condolences to the Wagoner family. He certainly, the stories that you're hearing and seeing on social media and throughout the news already is what a beloved man he was, a family man, and what a beloved lawyer. And also to, he raised children, Mark and his siblings, who contribute a great deal to make the community stronger. And so they're very well-loved family, and everyone is, our hearts are with them, and our thoughts are with them, and we respect this difficult time for them as well. And with that, we one of the things the EOC has been able to do is that we've asked the Board of Mental Health, so the Mental Health Recovery Services Board, and with the help of the information coming from Dr. Acton at the state level, who's the medical and health director with the Department of Health, some tips for all of us, because we have a lot of time to read, we have a lot of time to learn how to cope through this process, are what are some tips for us through the COVID-19 situation that we all face, and what are the coping skills that we can use. They did a terrific job compiling some of the state ideas and some of the local ideas and resources to help us find ways to help each other and to find ways to help ourselves cope in these trying times. They want everyone to recognize that that COVID-19 does have a potential to impact your coping skills and your mental health. They want you to know and to remember that distress or anxiety or fear are strong emotions that are normal in times of disaster or a crisis, whether it be the 9/11 that the mayor alluded to or the current situation that we're all in. If you have these feelings, you're not alone. A lot of people are experiencing these very same feelings, and they're feeling them in one way or another. So there are tips and there's ways to continue to find the family way or the personal way, or those that are home by themselves, ways to be able to cope. One of the ways, and it's odd that I would say this because we're right here in the media, is our mechanism to communicate with everyone about best practices and what's going on with COVID-19, but is the excessive exposure really sorts to wind you up and wrap you up and get you a bit on the stressed situation. So definitely become informed, but definitely find time to walk away from the information and do other things. Sometimes it's good to just turn off the TV. Stay healthy. People have said this repeatedly. Stay healthy, eat healthy, try to get some exercise, whether it's that walk in the park. I wanted to add to your comment, Wade, don't forget you can throw your Frisbee to your dog, too. So that was always a fun way to enjoy time with our family over the years. And try to get the adequate sleep. I've heard people saying they're waking up early, they're having trouble falling back asleep. Find ways to get some rest and try to stay hydrated. Try to avoid alcohol and drugs. Oftentimes with a lot of free time that you have, you may choose to use more alcohol or choose maybe a drug that you shouldn't try or that you've done and that you try again. Definitely don't try to use those kinds of mechanisms to unwind. Stay connected with family and friends. Discuss your concerns with others. Don't be afraid to share what some of your anxieties are. Keep finding ways to have hobbies or activities that help you feel that you're in contact with something, or that you're doing something that you've been wanting to do for years, and enjoy some of the free time if you can. If you have a mental health condition, continue with your treatment plan. Don't stop taking medicines. Continue with your treatment plan and monitor any new symptom, and find the health care provider that you need should you feel your behavioral health is somehow being compromised. Some of the signs of distress could be feeling hopeless or helpless, could be feeling numb, having anxiety, or having some disbelief. Is this really happening? You may find a change in appetite. People say that they're eating more, or they're eating more constant. They're feeling some nervous eating going on. Is your energy level high, or is it your energy level lower? Are you having difficulty concentrating? Nightmares, things like that. Physical reactions such as headaches or body aches, or worsening of some chronic health problems. Some of those come along with the coping issues that you may have right now in dealing with this experience that we're all going through. So there's a recovery helpline and we're going to put this on the website, the health department website, and share it with social media. But the recovery helpline is 419-255-3125, and that's available 24/7. There's an Ohio crisis text line. We'll put that on the website. And if you speak Spanish, there's also help to contact Adelante Latino Resource Center from 9 to 5, and we'll also make sure you have access to that information. I think about all my social work colleagues, as you know, that's my background, who are probably trying to find ways to help anyone and everyone that they can help, but it's really going to come back to try to help your neighbor, try to help your family, try to help the person next door, and try to stay in contact and monitor your own feelings and your own symptoms, as well as trying to monitor everyone else. These are difficult times. We're going to get through it. There's another side of it. I think we're feeling a little somber about our loss today, but at the same time, we're all going to keep moving forward and keep finding ways to help each other. So I'll turn this over to Eric for the health update, and thank you very much, and particularly on behalf of my colleagues and those members of the EOC. Thank you.
Thank you, Commissioner. Good evening. My name is Eric Szczynski. I'm the Health Commissioner with the Toledo-Lucas County Health Department. I would like to offer my deepest sympathy and condolences to the Wagoner family at this point in time. We have confirmed that indeed Mark Wagoner did test positive for COVID-19 after being hospitalized for several days, then passing away on March 18th. We know that Mr. Wagoner was an attorney and was in the Lucas County Domestic Relations Court on March 11th. That is a date when individuals could have been potentially exposed. If you had direct contact, less than 6 foot, and or prolonged contact with a confirmed COVID case, you should quarantine at home for 14 days from the date of the possible exposure. For this instance, this time frame will end on March 25th. Those who experience minor or moderate symptoms, including dry cough, fever above 100.4 degrees Fahrenheit, and shortness of breath. These symptoms can be treated with over-the-counter medications, drinking plenty of water, and rest. You would treat symptoms as though you have had flu. However, if symptoms worsen, you should seek medical attention. Should you need to visit the emergency room, please call ahead. Again, should you need to visit the emergency room, please call ahead for directions. Should your symptoms be severe enough to call 911, please alert the 911 operator you were in direct contact with a confirmed COVID patient. I'd like to repeat that, please. Should you or your symptoms be severe enough to call 911, please alert the 911 operator you were in direct contact with a confirmed COVID patient. Should your symptoms be severe enough to call 911, please alert the 911 operator you were in direct contact with a confirmed COVID patient. We truly do want to make this point, and we've said this now over the last couple of days. We continue to be concerned about our first responders and notified Springfield Township Fire Department as soon as we became aware of Mr. Wagoner's positive test, which was early this morning. The affected firefighters have been tested and are taking all necessary precautions, including self-quarantine. We did learn today of another positive case in our community and have been in contact with this individual and are ensuring that they are staying in self-isolation. This individual is not a resident of Lucas County. Because of that, this case will not be reflected in our local case count per Ohio Department of Health reporting guidelines. I would like to reiterate what both the governor and Dr. Atkins stated. Testing is not our top priority today. All resources in Ohio are being coordinated towards keeping people safe and healthy. But for now, we are asking that you follow the directives we provided yesterday and prior to. Stay home if you are sick, practice social distancing, and ensure proper hand washing. We understand the concern people have regarding a requirement of having a positive test before you can be excused from work, but that is not the directive we have from the state. We are continuing to work closely with the state of Ohio and local businesses on their time off policies. If individuals are unable to work because of reasons surrounding COVID-19, the state of Ohio has created a specific code number to use when applying for unemployment. These individuals may be eligible for unemployment benefits through Job and Family Services, and I'll give you the website at jfs.ohio.gov. We continue to refer questions on guidance, updates, and confirmed cases to our website, lucascountyhealth.com. And with that, I'd like to open up to questions, please.
The Springfield Township firefighters
Yes.
have presumably been in contact with other patients, other firefighters. Why weren't they notified earlier? And whose responsibility is that? Is that the health department or the hospital?
The question is that the firefighters have come in contact with not only the case, but then other individuals, and then whose responsibility is that? Again, the individuals that the firefighters, as I understand, as of this moment, were not symptomatic. So that is a good check mark box for the ability to not spread the virus. Now let me talk about how this all works. Again, we've come to you several times about positive cases, right? What we're going to do. We're notified by the Ohio Department of Health as of a positive case. This was notified to us this morning that it was a positive case. Our procedure is then to contact whoever we need to contact, whether that is the family, other individuals that came in contact with that individual, and that's what we started doing this morning. Again, we don't control the testing. As we've stated before, that testing can lag 5, 6, now I'm hearing to 10 days. So we did not know that it was a confirmed case of COVID-19 until this morning. I'd like to make a comment too. We're also battling flu again. So, you know, COVID kind of looks like flu a little bit, and so respiratory concerns. So again, we need to make sure that we understand that is also happening in our community. So that's another reason why we need to keep ourselves as healthy as possible.
Now that you know that Mr. Wagner was a positive case, is there a plan to follow up with the contacts of the firefighters and notify and identify them?
Yeah, actually, those firefighters, as we talked about, have been notified. They've actually went through the testing process. They are in self quarantine. So again, we've taken those steps to make sure that we protect everybody as close as possible.
What about people who've been in contact with them?
Again, the contact by contact, no, because again, the disease is such that unless you have the disease and you're showing symptoms, again, You're not going to pass that on to somebody as you would, if I was sick and you were standing next to me, yes, possibly. But if I'm not showing symptoms, we have to take that as you are not a COVID patient. Please. Yes, go ahead.
Surrounding this one, knowing that Mr. Wagner was having the test done, you're waiting on the test
Sure.
results, and you have the current protocol waiting until those results
Sure.
come in, are you going to take a look back and say, maybe we should let these people know in advance that we are looking into this?
That is a great question. So the question was about the protocol and what we're using, and are we going to be able to maybe do something different? I got to tell you again. The idea of procedures and processes are always changing. We've been looking at this very issue for a while now. We've been looking at guidance with CDC, and we have been talking with the fire departments and the first responders, and actually have a procedure that we're putting in place to help take us to the next step on this, so that maybe some of these issues that we have because of the reporting lag and things of that nature might be better off for us in general. Remember, what we're trying to do here, ladies and gentlemen, is trying to protect those first responders as much as possible. And as we see things coming down the pipeline, if we have to change it, we will. And I think what we're looking to do, though, is make sure at that point in time we're taking care of those first responders the best we possibly can.
With the three that were in the ambulance with
Sure.
them, or worked with them, have been tested. Is there any plan to test the rest of the firefighters in that house that worked with those folks?
Again, the epidemiology investigation, in other words, we go and call somebody and say, where were you? What symptoms do you have? That type of conversation. And from that type of conversation, then we deem if we need to test anybody else or take it to the next contact. Again, the only thing we have is, were they presenting symptoms? And if they're presenting symptoms, then yes, we would take that next step. And at this time, they did not present symptoms. Again, remember, we're trying to make sure that we're protecting everybody. Those first responders are going to be protecting us. So we have to take every step we possibly can, but they also have to be in that fire truck or in that police car to be able to respond to us. So it's really important to make sure that we get a good procedure down so that everybody stays safe.
I understand that we have limited testing,
Yeah.
and we're only testing first responders, which makes total sense, but maybe this is kind of a bigger issue at
Sure.
hand, but how are we supposed to know where we're at as a county, as a state, as a nation in flattening the curve, and how do we know if we're beating this if we don't have the capability to test everyone?
That's the question about we don't have a test, so how do we know if we're flattening the curve? I think there's other indicators. Just because we don't test doesn't mean that we're not going to have other indicators, such as how many people actually report to a hospital because of concerns. How many people, unfortunately, will we see pass? Again, you can look at the cases in Italy or other countries and then kind of model it against ourselves. So again, those are the secondary things that we can do instead of direct testing to be able to see how we're doing.
We've heard for some people that they might be worried about getting COVID through takeout from restaurants and things. Is there any truth to that?
That's a good
and
question.
should, what precautions should restaurants be taking here in the takeout area?
I'm sorry. The question was about takeout and if you should be concerned about handling the bags or things of that nature. Again, I think it goes back. I would not be concerned about handling the bags per se. Okay, you bring the bags into the house. You wash your hands. This is what I've done. You wash your hands. You take the food out of the bag. You throw the bag away or do whatever you need to do with it. Go back and wash your hands. Open up. I mean, this is really very regimented. But again, this is what I do at home. Open up the box or whatever. Wash my hands again, and then again, that's me though, and then put the food on the plate. So at any point in time that I can wash my hands, I would not be overly concerned about bags and things of that nature. But again, just making sure that you're taking that precaution if you're nervous about that. Okay? Again, I do takeout. Okay, I've gotten delivery, so don't be scared to do that. Again, just take those precautions. We got to support the restaurants. We got to feed ourselves. So let's do that.
As far as first responders
Sure.
who come in contact with people who either test positive or have tested positive, is the plan to test those first responders whether they have symptoms or not, or what is the process there?
Okay, the question was about first responders again and testing, whether they have symptoms or not. There's a lot of science behind this, and really there's very little that we can glean if somebody is being tested, whether asymptomatic. Okay, there's just not enough benefit to that. I will say the benefit here is that, again, let me take one step back. This morning, we had a very lengthy conversation with the infectious disease doctors from the University of Toledo and talked about some of these very things. What the first responders are doing now that they may not have been doing early on is more regimented use of PPE because of the issue of COVID-19. So again, as long as the first responders are wearing the necessary PPE, which they do know, and they wear that necessary PPE, we don't have a concern about needing to test because, again, that we consider them a very low possibility of coming down with COVID.
So was the plan to test these firefighters that came in contact with Mr. Wagner, or did the fire department ask you to?
No, I think it goes back to kind of where we're going with this procedure, in the sense that they had direct contact with a COVID patient. We found that out today. We enacted our procedure to say, okay, now you should go get tested.
Do you know what the total capacity of the local ICUs is, and what percentage are we at right now?
The question was, what is our total capacity of ICUs and where we're at right now? I don't know that. Let me see if I can't get that for us. Okay, I can't guarantee, but let me see what I can do. Okay.
Also, I've read when doctors do tests on patients for things, and something were to come back positive, they stop testing for further things because you could have multiple positives. If somebody were to present, and maybe this is a question.
Yeah, this is going to be a doc question. I'm going to let him talk.
If somebody were to present with multiple symptoms from multiple viruses, do you stop testing when it's possible further testing might reveal a COVID diagnosis?
Yeah, so again, the question is, do you test for multiple viruses at the same time, understanding that they can occur at the same time? Is that correct?
Yes.
So when you look at where we've gone with the protocol and understanding what Eric just said about an increase in flu, you want to use a smart testing regimen. You know, flu is more common than COVID-19. Let's test for the common things first. We know other causes of pneumonia. Let's test for those first. We have good information, and the information continues to grow, particularly from the places like China and Italy, that show us what we should be seeing in these patients. So the answer is you want to test, but you want to take common things common because they're more likely to happen, and use that answer appropriately. Now, if you have a positive test, say let's give a hypothetical situation. Patient tests positive for flu, treating him for flu, don't get better, suspect a co-infection, then that would be time to think of more testing. Okay.
Other questions? Anything else? I want to close tonight by, again, long week for everybody. Thank you to the media. Thank you to the community for adhering to all the things that we've asked you to do. We continue to need your help. Please, please, please stay at home. Be with your family. Watch TV. Take food out. Get it delivered. Enjoy life. And just be ready to take on the next day one at a time. All right? I want to also state that the community needs to understand that we are standing up here telling you things that we're doing. We are also working on things that we're going to try to do. This community, University of Toledo, the hospital systems, we're all working on trying to bring unique things to the community to help with this issue. So don't think that, just we're doing the basics thing. We are taking a very deep dive and trying to make sure that we're bringing every possible resource, idea to this community to be able to help it along in this crisis. So with that said, have a good weekend. We will be back if something major occurs this weekend, but if not, I think we will see you Monday. So again, have a good weekend, everybody. Thank you so much.